Just before we get started with this Fit Right Pelvic Puzzle podcast episode, the information shared in this podcast is intended for education only and should not replace personalised advice from your healthcare provider. Some episodes include fictional case studies to illustrate common presentations and how a multidisciplinary team might approach them. These stories are entirely fictional and are drawn from a mix of experiences in clinical practice, so any resemblance to real people is purely coincidental. Imagine being told by your doctor or your physio that having a prolapse means that you should stick to low impact exercise and you should never run again. But you love running. That was the case with our fictional character Karina, finally carving out time around her kids to get back into running, only to get prolapse symptoms and feel like she's doomed to a future without the exercise that she loves. Let's jump in and see how a team approach could help Karina put her puzzle pieces together. Hello and welcome to the Pelvic Puzzle. This is a podcast by Fit Right Women's Health where we break down the different puzzle pieces of various aspects of women's health with the professionals who can help you put it all together. I'm your host, Taryn Watson. I'm a pelvic health physiotherapist from Perth in WA. I'm a lover of early morning walks, coffee, red wine, and all things women's health and exercise. So today we're still in the season called the Prolapse Puzzle, and the episode today is called Karina, the busy mum of three considering a vaginal pessary for running. So as always, I'm going to explain to you Karina's story. I'm going to choose three main questions to answer and to deep dive into a little bit about Karina and her management. And then we're going to talk about all the different puzzle pieces that could be pulled together to help Karina have the best success possible. So Karina is 37. She has three babies. They were all vaginal births and they are now age 1, 3 and 5. So her recoveries were quite good. She was bothered by feelings of vaginal heaviness and bulging in the early months each time, but otherwise there was no real major issues with any of her births. They all went quite smoothly. After her first baby, she did go see a pelvic health physio. She told the physio about these symptoms. The physio did an assessment and she was diagnosed with what she remembers as being called a mild prolapse. She was given pelvic floor exercises. She did these. The symptoms got better. She got pregnant again quite quickly afterwards and then quite quickly after again. And she's been aware of the symptoms on and off, but it hasn't really been a priority. She's largely been able to ignore the symptoms and just get on with life. After the first baby, she got back into exercise quite quickly and quite well. After the second baby, she wasn't really able to do very much because of the load of having two little children at home, and that's got even worse in the early months after the third baby. She's sort of been in survival mode and not been able to really think about exercise, but it's been something she's been aiming to get back and get into a routine with for a while. So far, in the last few months, she's managed to increase her pram walking while the older two are at daycare. And she's sometimes doing some YouTube yoga videos, but that's a bit hit and miss. So that's what she's been able to manage so far. And she's super busy, but she's approaching the 18-month mark with her third baby. Her third baby has just weaned off breastfeeding. So she's feeling like there's a little bit more me time. And she's decided that the exercise she would really like to add in now is running. So she thinks that that will probably be the most doable, achievable thing, a few mornings a week to get up before her husband goes to work. Or maybe in the evenings after her husband comes home from work. She used to run before having kids. She loved it. She really likes that running involves no equipment, and that she can do it in like 30 to 45 minutes without having to get in a car or make a pre-booking to go anywhere. So she has started, she's tried a few short runs, but every time she does, she gets a return of those feelings of vaginal heaviness and bulging that she used to get in those early days after all the births. She noticed as well when she's cleaning herself in the shower that she can feel something there at the vaginal opening. So she Googled these symptoms. She found some support groups for women with prolapse on Facebook. Don't get me started about that. There's a whole rabbit hole that various patients of mine have gone down with Facebook groups about prolapse. Sometimes very helpful and a feeling of solidarity with other women going through the same thing. But unfortunately, more often than not, a little bit of a rabbit hole of the worst possible scenarios being talked about. Lots more over overthinking and worrying that comes from these groups. She has she has seen discussions as well on these groups where women have said that their doctor or their physio told them they definitely can never run again. They definitely can never lift heavy again. They shouldn't lift their child anymore. Yeah, there's definitely been a part of her in the last few weeks that's been thinking, oh my goodness, like I love running. It will fit in really nicely around the kids, but it's an option that I have to take off the table. And like, what is the low impact exercise that is going to be me now for the rest of my life? But she also did see a couple of discussions about women who've been fit with a vaginal support pessary and have got back to things like running. So she's interested to know more about that. And she's really keen to keep up this new habit. So this is the reason why she's booked in an appointment with a pelvic health physio. She's looked up online about physios that do pessary fitting and she's found me. So she's come to see me. She's explained all this. I've gone through all the other screening questions about bladder health and bowel health and her goals and her medical history. And we've had a big chat. We've also already had a little bit of a chat about the pros and cons of those aforementioned Facebook groups. And now I've offered a pelvic exam with an internal vaginal assessment to check what type of prolapse she has. So the findings from her assessment are that she has what we call a stage 2 anterior vaginal wall prolapse. So you can go back to a previous episode, I'll link it in the show notes, about that where I deep dive a little bit more into what is prolapse, what are the stages, what are the types. But just in a nutshell, stage 2 is divided into stage 2A and stage 2B, where stage 2A is just inside the vaginal opening or to the vaginal opening is where the one or more of the vaginal walls is coming to. Okay, so when you bear down and things move down internally, the point that we check is coming to just within a centimetre inside the vaginal opening or to the opening. Stage 2B is where it's coming to the opening or just outside, 1 centimetre outside. So stage 2 encompasses both of those. This lady, I diagnosed that she had a stage 2A prolapse that became a stage 2B when I assessed her in standing when she was bearing down. An anterior wall, what that means is front wall. So a prolapse can be the front or the back or the top of the vagina. For this woman, it's her bladder and the front wall of the vagina pocketing backwards into the vagina. And that's what she's feeling at the opening. That's what that bulge is the front wall with the bladder and the urethra behind it coming down towards the opening there. So this is really common. This is not a super uncommon presentation. And there would be a lot of women out there living with a stage 2A or stage 1 anterior vaginal wall prolapse and not being bothered about it. But probably what's happened with this woman is that it's starting to get more towards the opening and maybe coming out to 2B that she's being more aware of it, perhaps. So I also checked her pelvic floor strength and endurance and all of that, and I found that actually she's got really good pelvic floor, good strength, good endurance, and no pelvic floor injury is likely. Yeah, really pretty good. Like I found that she could optimize her strength and her endurance a little bit more, but actually, yeah, like I said, really quite good. So my deep dive questions for today's episode are: should Karina avoid running? Should she give up running and not do it again because she has a prolapse? Question number 2, deep dive topic number 2, what is a vaginal support pessary? Is it appropriate for Karina? And how would we fit it and what would we do? And then lastly, would this pessary fix her symptoms? Is this a cure or is this just managing her symptoms like a band-aid approach? Okay, so should she avoid running? In a nutshell, no. I wouldn't tell Karina to avoid running, that running is no good for her. I am a firm believer in exercise having so many global health benefits, and running is an exercise that has so many global benefits for women. I really feel like if she has found something that is doable in this really tricky, busy phase of her life, she's managed to get that little bit of time for herself around her husband and her kids, I am going to do everything I possibly can to help her achieve that goal of doing that without any long-term detrimental effects or without being symptomatic. So no, not going to rule out running. However, I need to help her do that in the right way. So I will tell her about the guidelines for return to running. There's some things that we can sort of test on a checklist to check for readiness. And I know, she has already been running, but if this was somebody who was coming to see me postnatally who hadn't started running yet, I might suggest that we try and see if we can work up to meet these markers before they do their first run. But Karina's already tried running. So I'm going to help her work out if she's meeting these markers for return to running. And if she's not meeting them, I don't feel like I should be in a position to ban her from running. It's her choice. It's just she can see that there's these certain markers that we know from expert opinion mainly are likely to decrease the chance that she's going to become symptomatic or get musculoskeletal injuries like shin splints and glute tendinopathies and kneecap pain and all sorts of things like that, if she can meet these markers first and get some global strength in her core, pelvic floor, legs before starting a running program. So I guess also I would explain, as well as working out from that checklist, like where she sits on what I call her prolapse risk profile. Like, is she sitting down the lower end of risk that this prolapse is going to get worse with running, or is she on the high end of that spectrum? And if she's on the higher risk end, what can we do with regards to pelvic floor strength and other things to get her down to the lower risk category? And, can we put a pessary in potentially to move her down into a lower risk category for things worsening while she's running? But also, I would explain to her that there is also a spectrum for riskiness of exercise. And although I'm really happy that she's found something she loves, there isn't any getting around it that running is not on the low end of the risk profile for riskiness of prolapse worsening with that type of exercise. So, you know, exercise where you're lying down and doing anti-gravity exercise is very, very low risk for prolapse worsening. Very, very heavy weight lifting and exercise involving repetitive ground reaction forces like running, that is considered to be on the higher end of the risk profile. So, you know, these decisions are completely up to her, but I'm not going to sugarcoat it that running is a low risk exercise for prolapse worsening. It is on the higher end of risk. But like I said, we can try and work out other ways to manage that to get her in a category where she's going to be less likely to become symptomatic, less likely for the prolapse to worsen over time, and more likely to stick to the exercise because it's something she actually loves. Impact, and just on that note about impact exercise like running, the recommendation is to wait for about 3 months postnatal to consider adding impact exercise. Obviously, Karina is a lot further than 3 months postnatal, but just if it was somebody other than Karina that we were talking about who was earlier postnatal, I'd be explaining that to them as well. I will put these running guidelines that I was talking about in the show notes so that you can have a read. But in summary, I guess what we would be testing for this checklist I was telling you about is I would be testing Karina's pelvic floor to check for a few things, namely like strength. Does she have enough strength to go through the full range of her pelvic floor? Does she have good enough endurance to be able to do things like hold for a maximal contraction for 8 seconds and do at least 8 like that in a row? Then I'd also, and I'd be looking at when she bears down, how much movement there is at the vaginal opening. We call that distensibility. And look at that as far as like how much her prolapse kind of balloons down and things move under load without a pessary. Then I'd be looking at, do her leg muscles have enough strength and endurance for the rigors of running? Because she has had some time of deconditioning. There's no two ways about that. Like she used to really like running before. And she possibly did a lot of strength and conditioning stuff before she had kids too. But in the last year, she hasn't really done very much at all. She's done some gentle yoga videos on YouTube and she's done pram walking. So she very likely will need to do a strength and conditioning program to minimize her risk of issues. And we're talking about, you know, leg issues, leg injuries and issues here, but also having strong legs and strong glutes and good control over the pelvis and good alignment in your legs with regards to running technique and things. All of that can significantly take the load off the pelvic floor when you're running. So those are definitely puzzle pieces as well with regards to management of the prolapse and prolapse symptoms during running too. So some of the tests that we might do would be single leg squat or single leg sit to stand. Can she do 20 each leg? Can she do 20 single leg calf raise each side? Can she do 20 single leg bridging, like reverse bridge, lying on the floor, lifting her bottom up and down with one leg? There's some load management tests as well. Can she hop on one leg at least 10 times on each side with good technique and no symptoms of prolapse or leakage or pain or anything like that? Can she run on the spot for a minute without any symptoms like that? And there's other things to tick off as well. So that was my long-winded answer to should she avoid running? No, not necessarily, but she probably should tick some boxes beforehand in the lead up to it. And then the other part of that about avoiding running and readiness for running, especially if she does have a stage 2A to 2B prolapse, and when she bears down, it is moving down. she has already tried running and she was symptomatic. I think this is going to be a woman who is likely to benefit from a vaginal support pessary. So let's talk a bit more about what is a pessary, how is it fitted. So a pessary is a silicone device, often a ring shape, that's inserted into the vagina, and where it sits would give extra support to the vaginal walls. So for this woman, we're looking for a vaginal support pessary that would give extra support to the front wall. Um, it would there are lots of things that would need to be taken into consideration when we're choosing, when we're deciding together about pessary fitting. So, firstly, is she a good candidate for it with regards to vaginal tissue health, and like medical clearance for pessary use? So, someone like Karina, I would almost always send to one of our women's health GPs for what we call a pessary co-management appointment. To do a bimanual examination and a vaginal speculum examination for the vaginal mucosa to just check whether she might need any topical estrogen and to get a really good baseline and rule out any other medical stuff that might be going on from a pelvic health point of view. So let's say she's done that. Then we also have to determine, is she a good candidate from the point of view of, is this going to be a successful fit? And can we just use the sort of most straightforward, most common pessary, which is the ring pessary? So, like I said, a ring pessary would probably be good for the front wall, like her type of prolapse, the bladder prolapse. That a ring pessary is one of the pessaries that would help with that. Um, we would look at, can she get it in and out herself? And that would be one of the tests we would do. We would also be looking for, has she got enough muscle bulk in the vaginal wall, in the vagina, the pelvic floor muscles, to support the pessary and keep it in place. I said before that when I assessed Karina, I didn't think she had an injury on one side or the other of her pelvic floor. So that's great, because if she did have an injury on one side that made one muscle bulk significantly less than the other, or both significantly less, it can mean that there's not enough bulk for the ring to sit on, and it can drop down on the side where there's less support and then come down and out. You can lose the pessary and have that bothersome feeling of the pessary dropping down and out. So we don't want that. So we need to check that she's a good candidate for things like that. But just taking on what I told you about Karina's assessment before, I think she's going to hopefully be a good candidate for a simple ring pessary. And I think that she could choose to either put it in and leave it in for all day, or even multiple days or weeks at a time if we work out that management plan accordingly. Or she could only put it in just before her run and take it out after. There's pros and cons to both of those. So that sort of brings me to the last point that I wanted to talk about with regards to Karina is, will this pessary is it a band-aid approach? And is she, in particular, if she's just putting it in for a run and taking it out, is it literally just, extra support for that time? Or will it fix her prolapse? And this is a question I get asked a lot about pessaries. In fact, I often get asked something, even the next step on that is, could a pessary actually make things worse in my vagina? Because will it make my pelvic floor muscles lazy and just, hold everything up, and my muscles won't have to do anything? On that note, no, it's possibly the opposite. If you have the type of prolapse in particular that is coming down towards to the opening of the vagina or outside of the opening, if you picture that the pelvic floor muscles come in and close off like a trapdoor, close off the opening of the vagina and lift everything up from there. But if the front wall is already sitting down there and you're trying to bring the pelvic floor in and under it, if it's down there already, you're not going to be able to get an effective pelvic floor contraction. You won't be able to close off that trapdoor. So by putting a pessary in and lifting the front wall back up, you actually are probably going to get much more effective pelvic floor training happening, because you'll actually be able to lift up underneath the prolapse again. So actually lifting the pessary, lifting everything up into an anatomically correct position could mean that you get way more benefits to pelvic floor muscle strengthening, and maybe that might actually have a positive impact when you're not wearing the pessary as well. So no, I don't think we could say that a pessary could make things worse because it makes the pelvic floor lazy. I always encourage women to be extra diligent with their pelvic floor exercises when they've got the pessary in, so that they're getting lots of good bang for their buck while everything's held up in a good position. Which kind of brings me to the next point of should Karina be wearing it all the time, or should she just wear it just for running? That is completely up to her. We know there is some small limited research that is not really able to be definitively commented on, but it is possible that it could be more so than just a symptom management. A pessary being worn, in particular being worn for longer periods, could actually help remodel the connective tissue and the fascia, and like I said, help re-strengthen the pelvic floor, so that then down the track, when you're not wearing the pessary, you might actually have an anatomical positive change in your prolapse. Very important to note, though, that that's not always the case. It is very possible that because prolapse is a damage to the fascia, it's the fascia being either torn or stretched in order for that to have fallen down. It is possible that the symptoms will be better with the pessary in, but it's possible that remodeling might not be achievable, and then when the pessary is out, the prolapse might just sit down where it was before. However, if that's the case and you can manage with very few symptoms, with the pessary being worn most of the time, then you can get globally fit and strong. You can achieve all the other health benefits of exercise that the prolapse was previously stopping you being able to do. That's a win. Maybe we're thinking surgery down the track, or maybe not. Maybe this is a long-term possibility, and maybe, depending on, Karina's young, but sometimes it's just a possibility for this high load times of life, like when your kids are really little and you're lifting them up a lot and there's a lot of pressure on there, or when you're exercising at a high level, but then maybe as you're getting older, you're not exercising at such a high level, you're not lifting 3 babies, 3 little children repetitively all the time, and maybe you can wean off using the pessary. Even if nothing anatomically changed, maybe it's more achievable to then be symptom-free through life later. So pessaries can be used in so many ways, and they can be used definitely for younger women like Karina. And I think in Karina's case, pessary could be a big puzzle piece in helping her achieve her goal of being able to run as her chosen exercise, without being symptomatic for prolapse, and without fear of the prolapse worsening. So, which brings me to the final part of today's episode, which is about just recapping what the puzzle pieces might be for Karina's management. We talked about pelvic floor as a puzzle piece. Yes, she's someone who probably will benefit from long-term pelvic floor exercises, keeping them strong, keeping them coming on at the right time, keeping the endurance good. Just things to consider. Like I said, she should be doing pelvic floor exercises when the prolapse is up out of the way, whether that's in an anti-gravity position or when she's got the pessary in. Another puzzle piece, pressure management. Can she be taught how to breathe and pre-contract her pelvic floor in a way that daily activities like lifting her kids, lifting the pram into the car, a cough happening, these things, can they be done in a way that helps her put as little pressure as possible down in the cylinder. Pressure management is a big puzzle piece, and that's a big thing that physios will teach someone like Karina to do. Support wear, yes, maybe she might be helped by wearing some support shorts with the compression shorts with the perineal support while she's running, with or without a pessary. Sometimes that can really feel nice to have that upward support from compression shorts. Another puzzle piece, like I said, is almost definitely pessary. Another puzzle piece is a graduated return to her running programming, with a strength and conditioning program potentially being put in place for her to do at home. In the times where she would have done her YouTube videos, can we put a progressive strength and conditioning program in place? Or logistically, can she go to the gym and do that? Or can she come to one of, like, we run our toddler and me classes where she could bring 1 or 2 or 3 of her kids along and do a resistance training class with a physio. These sort of things. Another puzzle piece is her weight and her diet. Like, I don't know if this is a puzzle piece for her. We didn't really talk about this, but definitely in the postnatal period, there are women who need to look not just at the puzzle piece of exercise and getting back to running from an exercise point of view, but the nutritional aspect of that too, and what she would need to be eating to optimize her return to exercise for health and function. And like I said, sometimes in this, for a woman like Karina, sometimes an additional goal and aim is to get to a certain weight that would be less load through joints and through the pelvic floor. We didn't talk about this with Karina, but that's possible. That seeing a dietitian might be a puzzle piece here as well. Also, we didn't talk about whether she's constipated or not, but repetitive straining on a prolapse is not good for prolapse management. And so often a women's health dietitian will get involved to help with nutritional health to do with, and gut health to do with optimizing stool consistency. Medical management, yes, definitely. I already spoke about the GP getting involved here. And making sure that they've done a pre-assessment for pessary co-management, and maybe topical estrogen. Will they refer to a gynae? Maybe, maybe not. It would be very unlikely that a gynecologist would do surgery on somebody who's got children the age that Karina's children are, because of how much is needed, how much rest time is needed in the weeks and months after the surgery, to make sure that the surgery is successful. It's very unlikely that surgery would be an option in the near future for Karina, but she might want to go and talk to a gynecologist about what the options would be in the future if this continued to bother her significantly going forward. And counseling or psychologist, maybe. We didn't speak about anything to do with any flags for needing psychology input, but there are often lots of puzzle pieces that need to be put in place with regards to prolapse diagnosis and how that makes a woman feel about her body and her future health and things like that. So that's something to consider too. Okay, so thanks so much for tuning into the Pelvic Puzzle. If this episode about Karina resonated with you, I'd love for you to share it with a friend or leave a quick review, and that will help more women get access to this kind of information. If you're looking for support, the team at Fit Right Women's Health is always here to help. Our Women's Health Clinic is in Applecross, Western Australia, and we also offer telehealth appointments. You can find links to book an appointment or an exercise class with us in our show notes. I'll catch you next time as we keep putting the pieces of the puzzle together, saving the world one pelvic floor at a time.